Hey guys, so I've been doing HGH for about a month now, and I've been experimenting with different methods on how to inject it in the body. The main method I've been doing is in the stomach fat, which is the subcutaneous method, which is essentially pulling a little bit of body fat out and then you inject it in that. And then there's different modes of subcutaneous injection through the body that you can look for yourself online, and I recommend if you're doing it subcutaneously that you change it up. Like you don't just do the same site all the time, because that could have. And I talked to a professor at my school about this exact topic, and he says that it can have a negative effect on the capillaries that you're injecting it into, which makes sense. Like if you keep injecting something in the same capillaries, it can potentially damage over time. So there's this like kind of like you take different routes of injection to do it, like different injection sites, which makes sense. And he said you can do it even the inside of the leg, and there's different parts for subcutaneous. Now you can also take human growth hormone intramuscular injection sites. And again, I talked to this professor, and he said if you're doing it intramuscular, for example, in the deltoid right here, he said first of all you take your arm and you go this way, so it like opens up right here, and then you don't use just a basic insulin syringe, which I'm using, which I actually have injected in my deltoid. I have done it, but it's more of a 1/2 inch syringe, and you go just directly into the muscle and inject it. You can also do it in the glutes, the ass muscle. He says don't do that because it's hard to do it on yourself, but I've seen people can do that, and as well you can do it in your quad as well, which is your leg muscles. Now I was looking at different articles online, which is what's the best. And at first I came across one that said doing it intramuscularly is beneficial in the end because it doesn't produce as much like resistance in the body, like to it over time. Like if you do it like this is what I was reading before, that if you're administering it subcutaneously, your body's going to build a resistance to it easier. And I can only imagine why. I'm going to speculate why, which is like our own body's immune system and things, and the like response to it as well, because it's a foreign thing that we're injecting in it, right? And our body's going to respond and deal with it. It's going to transport it to where it needs to go and things. And there's also receptor sites that potentially, this is just me speculating, that you're going to like create more of a resistance based on the receptor sites is going to build a resistance to that. Now, I did further research because this is something that in my own intake of it, I want to see what's obviously I want the best route of administrating. So I came across this article, a comparison of subcutaneous and intramuscular, I don't know if you can read, human growth hormone therapy, hormone deficiency. And just to sum it up, very simple article. It says, we conclude that subcutaneous injection of HGH is an effective and safe mode of therapy for GH deficiency, and blah, 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 blah. Subcutaneous administration of HGH will be more acceptable by the patients, less pain, and less non-compliance. So it's just saying that it's easier, and in the end, there's not going to be as much of a negative effect in the administration of it. And this is something that I also kind of concluded myself in my own conclusion, I guess you could say. It is subjective, but that I don't think there's going to be much of a difference. Okay. Now, some people would argue that if you were to take, if you say you wanted to build your arms up, to inject it in your arms is going to be there ready to build your arms up. So, or for example, you have an injury in your shoulder. Now, injecting it, say in your left shoulder, like right here, injecting it in that left shoulder close to that glenohumeral joint is going to be closer, so it's going to get there and it's going to rebuild that joint better. Now, I'm going to do more research on that, but to be honest, my basic instinct is that it's not going to do it that much better, at least, because when you go here, it's closer to the liver, and it goes everywhere in the body. Like when I inject it here, within a matter of minutes to like 20 minutes, I can feel it everywhere. I can feel it behind my eyes. I feel my toes sometimes and things moving through my body. It's just something that you can feel. So I think it goes through the body very effectively through there, and it's going to go to the liver where it's going to be converted to IGF factor 1, which is the thing that's actually going to grow your tissues. Now, your bones and your connective tissues can convert HGH to insulin growth factor 1 as well. So that being said, like, yeah, if you're closer to the joint, it could potentially hit it faster and then grow it faster. But I don't think so. I think like any other hormone that's produced, for example, this stuff normally is produced in the pituitary gland, and then it goes through the body, right, in the bloodstream. It gets released in the bloodstream, and then anything that gets released in the bloodstream, as long as there's the right receptors, it's gonna hit. And as long as you're doing it in the right quantities, which if you're doing HGH, you will be. You'll probably be doing it in excess of, actually. Like what I do it first in the morning and at night. So, and when I do it at night, I'm gonna do it probably in like 20 minutes before I go to bed. It's gonna be there. It's gonna be traveling through your system. As long as there's receptors, it's gonna get it. Okay. So that being said, so I'm just gonna read this. Across over 9 months of therapy determined patient acceptance from intramuscular versus subcutaneous injections indicated overwhelming acceptance of the subcutaneous route. The antibody response to HGH were similar in both groups. Okay, so that, and this is a PubMed article. So I believe that subcutaneous route is going to be the preferred route, especially if you're beginning into it. Now, there might be, if you're doing it over a period of time and you want to change it up, yeah, sometimes you might inject it intramuscularly. It says here that there's similar in both groups, so it still works intramuscularly. Okay. Now, so like doing it intramuscularly is not going to be worse by any means. Now, it's a bit more deeper. It's directly in the muscle. Maybe there are some benefits there. I'm going to look into that a little bit more, but I've been doing this now for just over a month, and I feel like I've been getting the benefits. I feel like I have both the positive and negative results of doing HGH. Negative results being fluid retention. You can look at my previous videos. Nothing serious because I'm only doing it at 2.5 IUs. If I was doing it more closer to 4, that fluid retention and other issues that are normal with HGH would be more prevalent. But I'm not. So I just like this is concluding. I will concur with that in my own conclusion. My own experience that subcutaneous route of injection through the body fat is going to be an ideal and highly beneficial route to take, especially if you're just new to it. Now, in the end, and later on, if you want to inject it in your ass or your delts, it's still going to work too. Okay, so I'm not going to deny that being a bad route as well. So I'll leave it there. What do you guys think about that? Subcutaneous versus intramuscular injections of HGH. Thank you for watching. Peace.